very warm welcome to another exciting edition of your favorite program, Health Affair on AIT. On the program, we focus on critical public health challenges, issues of women and children with a view to finding lasting solutions. I am your host, Oshuomowa Daniels. Persons born with cleft lips and palate are often regarded as evil and stigmatized in the society. Figures by the World Health Organization, WHO, puts the yearly statistics of persons born with the defect at 6,186 in Nigeria. The challenges faced by patients with this condition, the misconceptions on how they can live a normal life with access to necessary surgical intervention is the focus of today's edition of the program. First, let's bring you reports about recent issues that dominated the health sector on the international and local scene.
The Presidential Steering Committee, in line with the Federal Ministry of Health and the National Primary Healthcare Development Agency, has approved the administration of booster doses for persons that have completed their 2 doses of AstraZeneca, Moderna, Pfizer-BioNTech or 1 dose of Johnson & Johnson. According to Faisal Shuaib, the CEO, Primary Healthcare Development Agency, the COVID-19 booster dose gives greater protection against the virus. He urged all Nigerians to take advantage of the opportunity offered by the federal government of Nigeria. He listed the eligibility criteria for taking the booster dose as anyone above 18 years of age, time interval of 6 months or more after receiving the 2nd dose of AstraZeneca, Moderna, or Pfizer-BioNTech.
To reduce the spread of Omicron variant, doctors in the employment of Lagos State government, known as Medical Guide, have called on Nigerians to take necessary precaution. Briefing newsmen about their forthcoming annual general meeting, they noted that due to the large volume of human traffic and large gatherings associated with youth out, there is a likelihood of spreading the virus.
We know that viruses tend to mutate over time. And the challenges that occur with mutation is anytime there's a mutation, there are concerns whether some of the protective measures that had been adopted earlier against the previous variants would work, especially the issue of the vaccine. And of course, the second challenge that keeps coming up is anytime you have a mutation, there's a concern about how virulent the new mutant that has come up would be. There's still a lot of data that is being taken on board concerning Omicron. And for now, at least some of the studies have shown, at least from different parts of the world, have shown that there is some level of protection of the vaccine. The advice to everyone is that this is the best opportunity to try to get vaccinated because there's been an expansion of the vaccine program. I know that right now, apart from accessing these vaccines at the primary healthcare centers, or I know now a lot of private hospitals have come on board because a lot of people complained. I mean, some Nigerians don't like going to public facilities, but this is an opportunity for them to leverage on the private facilities that are coming on board. And we also know that there's been a lot of advocacy that even among the religious gatherings, vaccines can be administered there and social gatherings. So we want to use everybody to use this opportunity to get in touch and try to ensure that they get the vaccine. Secondly, let's all use our face masks. Let's try to still maintain social distancing as appropriate. Let's try to do, our hand washing. And when people fall ill, I think that anybody that feels ill, has any symptoms, whether it seems like the flu, cough, catarrh, fever, please, they should approach any of the testing sites and try to get tested.
Given the brain drain in the nation's healthcare system, tackling human resources challenges also came to the fore.
We were delighted when Mr. Governor gave approval for massive employment, both at the level of the primary healthcare, secondary and tertiary. It was unprecedented. And our own challenge now is how do we keep these people within the system? Because after a year or two, you're just going to see them disappear again, and it's like a vicious cycle. It demotivates when you see your colleagues, highly skilled professionals like yourself, leaving the country. And sometimes you even need to ask yourself questions, and we've been asked questions. That is it that you cannot function outside Nigeria, or that's why you are still here? And we don't believe so. We believe that we also have a lot to offer. We are Nigerians. We are Lagosians. We also want to give the best. And One of the ways for us to achieve that is, of course, continuous dialogue with the government.
Going forward in the year 2022, the doctors also called for an improved national health insurance scheme and healthcare financing.
We actually started as a result of we asking ourselves a question. We create awareness every single year. When we come to Lagos, what we usually do in Lagos is what we call the Pink October. And in Pink October, we usually block the entire road around Alade Market with massive crowd, and we all go on pink, painting the entire city pink. But we asked ourselves questions because people come out, women come out and receive tens of screening. Men come out, receive tens of prostate cancer screening. But we ask ourselves the question, after these women and men have received the screening, do they get the better care? Do they actually receive the optimum treatment that they need? So we could not answer that question. And we begin to find a way to explore this problem. And we decided to start this program known as Upgrade Oncology. For us to do this training, what we did was to mobilize a steering committee, which was about 9 people from all over the world, actually, because the chair is actually based in the US, Dr. Binna Nwaneri.
I'm to Nigeria to meet with you and to help with training of these oncology pharmacists. This is such an exciting time, and so proud to be here today to work with each and every one of you, and look forward to the relationships that we build over this next week.
We are all here, the research we do, the questions we ask, the care we deliver, the empathy we show, all of that has to be directed with the patient at the center of everything we do. Otherwise, we're lost. And so we are here to bring that passion, bring that education, bring that listening as our Fulbright Specialists Award to allow us to help you help patients and to help you help others to help patients.
This is such an important training because pharmacy is such an important thing because most of the cancers are actually treated with drugs, with therapies, and other forms of medications. And there is a need to provide training to these people who are providing this chemotherapy, to them who are also giving these medications, because people cannot give what they don't have. And it's so important that we are doing this not just in terms of one region, maybe in the north or only in the south, but we brought pharmacists from all over the 6 regions of the country.
It's a joint thing, being led by the physician himself. But it's for them to know and accommodate and give room for the best for the patient. Because the center point, the bottom line is the patient. For the patient to have the best from all the team, all the members of the team handling the patient. If there is no war, it's because of lack of information. If you travel outside, my sister, you will know that abroad, maybe US, maybe UK, there is a teamwork.
Thank you to the Executive Director of Project Green Blue for making this possible.
No means no! No means no! No means no! Zero tolerance! Zero tolerance!
Globally, an estimated 736 million women, almost 1 in every 3, have been subjected to intimate partner violence, according to reports. In Nigeria, sexual violence is also a big problem that assumed a more dangerous dimension during the COVID-19 pandemic lockdown in 2020. The desire to put a stop to this menace brought together over 2,000 men, women and youth from across Lagos State and 3 other continents in the Zero Tolerance March.
If you open your eyes, you will see it. You'll see it in your families, you'll see it in your workplaces, you'll see it on the street. It is up to everyone, and in particular men in this country, to actually step up and say this is not acceptable. If you want to be a real, Nigerian and a real man, there's no place in this country for violence against women and children.
When there's a case of rape, there are certain steps that must be taken. The victim must not back. The victim must not reach. The victim must not change the clothes. And if there's a condom that has been used, that condom must not be destroyed. These are the evidences that should be taken to the hospital and disposed of from there.
Tolerance March was first launched in 2019. This is our third one. As we all know, last year with the COVID pandemic, we all had to pivot and the march went online. Today, we're very happy that we're all able to again reconvene, remain connected, stand against rape, sexual violence, trafficking, and child abuse. And we're all simply out here to say no tolerance. We've had enough to the scourge and the menace that we find in all our communities across the Federation.
Speakers at the event also cautioned against some cultural practices that put women at a disadvantage and the need for more enlightenment campaign.
In Nigeria, unfortunately, women are subjugated, whether they're abused or not. We rely on our social and cultural practices and norms, and sadly, communities survive a shame. A girl cannot speak out against the abuse because she's afraid. She's afraid of her family name. She's afraid that she'll be ostracized by her community. So what communities have to do, what families have to do, is stand by the survivor. Give her a platform to speak out. Let her know that she's safe. Allow her the freedom to be able to exercise her rights, to name her abuser. And then we rely on essential services to offer her the medical attention that she needs. We'll rely on law enforcement to apprehend the assailant and the alleged perpetrator. And then we rely on the laws to ensure that there's a successful conviction and that he spends the rest of his days or her days in jail.
The United Nations 16 Days of Activism Against Sexual and Gender-Based Violence, which begins from the 25th of November every year, provides an opportunity for people across the world to stand up against gender-based violence. According to figures by the World Health Organization, WHO, and the United Nations, more than 1 billion people experience disability globally, and this is predicted to rise following increase in population growth, prevalence of non-communicable diseases, and age. Despite the unimpressive indices, many countries like Nigeria do not have adequate infrastructure to meet the needs of this set of persons. It is in recognition of this that the Nigerian government recently established the National Commission for Persons with Disability.
Implementation of that commission is very, very important. If all the aims and objectives of the commission are not implemented, people with disability will not have a feel of that particular commission. Disabled people don't get the same kind of job that others get, the able people. In terms of education, they had been deprived.
With the 2021 theme, Leadership and Participation of Persons with Disability towards an inclusive, accessible and sustainable post-COVID-19 world, the occasion provided an opportunity to discuss critical health needs of persons with disability.
We are now talking about what happens to us after the COVID-19. What can we do after where is our place in the post-COVID-19 world? Meaning we are building it back now. When you say building back better now, we are trying to build up our formidable forces in the disability world, all the PWDs, to say that we are not just a person, or we are not just an object of the society. We are a human being like every other person. So in this post-COVID-19 world, we are still talking about what we have always been talking about, that is inclusiveness. We needed to be included in all the policies that is going on.
People with albinism, our own case is skin cancer, which kills. It kills albinos seriously. Just last month, a person with albinism died in Ekiti State due to cancer of the skin. So if that can be looked into, maybe by giving them, there is a particular cream that is good for sunscreen. They can give this to albinos, and even if they have sun, they can use Efudex. That's that, and it's very, very expensive. Just one tube is 50,000 naira. So taking care of disabled people is very, very expensive. That is why we need the help of NGOs, federal government, individual philanthropists.
They must be provided for. They must be able to choose the government they like. They must be able to choose the leader that rule them. That is when those leaders can be cautious and even think of taking better care of them.
The International Day of Persons with Disability is marked 3rd of December every year to promote an understanding of disability issues and mobilize support for the well-being of this group of individuals. Oshuomowa Daniels, AIT News, Lagos.
The National Agency for Food, Drug Administration and Control, NAFDAC, has destroyed tramadol valued at about 2 trillion naira in the last 4 years. This was disclosed by the Director General, Mojisola Adeyeye, who said over 8 billion naira worth of unwholesome medicine and products were also destroyed within the period. The DG also added that over 20 prosecutions of people responsible for counterfeiting or trading in substandard falsified medicines have taken place, while most are still ongoing. Adeyeye said the agency is putting mechanisms in place to ensure that Nigeria turned its tide of drug security from 70% imports to about 30% imports by the year 2025.
Any individual with an ambition for success must constantly focus on the direction of change and learn to adapt quickly in order to survive and grow. Our mandate is to build leaders and equip them with the skills and competencies to adapt speedily to a changing world. Be able to renew themselves and evolve continually by continuously looking for ways to make things work and improve themselves and their environments. We therefore use this medium to invite you to take the bold step to grow. Join the Institute of Change Management.
To be able to navigate maximally and achieve optimum performance in this unpredictable and dynamic environment that we find ourselves, there's a need to equip ourselves to be able to adapt intellectually, culturally, technologically, and professionally. Indeed, ICM was vetted to guide the development of reservoirs of new knowledge, skills, and ideas that we can deploy to harness and productively utilize to serve organizations and by extension humanity. What affects the society very much affects us. That is what informed today's discourse, drug abuse in Nigeria, challenging the narratives. Of course, I don't know how many of you have not heard about the new scourge. They call it in the East, Miri. We knew about India hemp, heroin, cocaine. Now the 18 is ice. Mates. They are everywhere around us. Our children, our relations. We must interrogate some of these things so that we know how to educate ourselves and educate others. How to avoid this, fall into this pitfall.
General Buba Mara would have loved to be in your midst. In fact, I am going to be reading what he sent down to me. I consider it an honor for this opportunity to share with you how NDLA is changing the Nigerian drug abuse narrative. NDLA is in the news these days, mentioned in connection with arrests and convictions of traffickers, seizures, and destructions of shipments of illicit drugs. But I tell you, those stories offer just glimpses, not the big picture of Nigeria's drug profile. When you stitch together intelligence reports, research, statistics, and empirical evidence, you can then start to get an idea of how big the drug abuse leviathan is in this country. Without mincing words, the drug problem in Nigeria is massive. The facts and figures are in the public domain. For example, the National Drug Use Survey 2018 indicates that 14.3 million Nigerians, representing 14.4% of the country's population, use psychotropic substances aside from alcohol. Previously, we used to be a transit country for controlled drugs and illicit substances, whereby cocaine and opiates such as heroin are ferried from Southeast Asia and South American to West African region then onward to Europe. But those dynamics have changed. Nigeria has become a consumer country. We became the biggest grower of cannabis sativa, with 90% of psychotropic plants cultivated, consumed within the country. Aside from smoking the plant, our youth now convert cannabis to new psychoactive substances such as monkey tail. Monkey tail is cannabis mixed with ogogoro and all sorts. In places like Plateau State, they put battery water, and sometimes when they consume this, it leads to death at the end of the day. The drug abuse situation got so bad that over the decade, prescription opioids like codeine and tramadol were abused with impunity, to the extent that they are used as main ingredients for drinks such as sushi. That one, when they mix it with blackcurrant, they put tramadol inside, cannabis is inside, they concoct it together, and it gives them temporary madness. This abuse of psychoactive substances happened mostly among users aged 19 to 54, and predominantly among those in 29 to 35 brackets. It is not difficult to figure out where Nigeria was heading if the drug abuse situation were to persist. To change the country's drug abuse narrative required that we do things differently. For that purpose, on January 25th, we launched Offensive Action, which is a non-stop tracking and interdiction of drug shipments and traffickers. Thus far, the campaign is paying off. It has culminated in the arrest of over 10,355 drug traffickers, with over 1,000 convicted and others going through trial. In the process, we have seized, as at the end of November, over 3 million kilograms of assorted drugs and cash valued at 120 billion. While the arrests and seizures are the highlights of our activities, we are, however, seeking a permanent and far-reaching change, namely a change in society attitude towards drug abuse and trafficking. It is to this end that we launched the War Against Drug Abuse WADA campaign, which is meant to, in the long run, help to prevent the entrenchment of drug abuse culture among our young people in society. Let me seize the opportunity of this quality gathering to ask the leadership and the members of this institute, as well as everyone here, to join the WADA train by spreading the message against drug abuse and illicit trafficking.
I award to you today, full member.
On behalf of the Institute, I want to do this presentation as an appreciation award for a job well done, for being a good representative. Thank you so much, madam. Thank you so much.
Please sit tight and watch our special report on cleft lips and palates.
Whenever my friends or maybe outsiders use me or insult me with the way I am, I feel depressed. It's not any kind of discrimination. It's not any kind of discrimination.
Grace Okpara has had a surgery to correct her cleft lips. She's waiting for another section for the palate and therapy to correct her speech defect. When she was born 18 years ago, her mother was faced with the temptation to abandon her in the hospital because of the embarrassment she suffered as a result of her looks.
And in fact, when I had the delivery at Ikeja General Hospital, and she was showed to me, I was scared to say, but I encouraged myself. Even my husband, the doctor called him and asked him, "Do you want the baby or we should go with the baby?" My husband said no, that they should not go with the baby, that we want it. And we were given the baby. So caring for her, it was not an easy task. People were like, where did you get this from? And I was saying, well, I was not the one that made the child, that's what I have. That's, I don't know. I just believe that God will make it well for me.
Grace is a lovely child. I think I've been very lucky with her as a patient. My first interaction was with her father, who called me incessantly at a time before we were actually doing orthodontics for cleft patients. And he called me repeatedly to the extent that I actually got quite upset, and because I was on leave. And I said to him, look, you need to go back to the cleft clinic and talk to them. But when I came back from leave, they were still on ground. And I just took to her when she came and explained to Mom that we're going to come and dance at your daughter's wedding. You shouldn't worry too much about it, that we'll get where we need to go. And what I found when I saw her is that she had a bilateral cleft lip and palate. She had a completely collapsed maxillary arch in all dimensions. So meaning right from the front teeth were all the way inside instead of being outside the lower teeth, the upper front teeth. The side teeth were all the way inside the lower teeth, whereas they should actually stand outside. So I knew that I had my work cut out for me, but part of the reason why I got into treating cleft patients is because of the challenge. So I just looked at her as a challenge, and my next issue would be how cooperative the patient would be, because one of the issues we have with cleft patients is that many of them come from lower socioeconomic groups and they have other priorities, and so it's difficult to keep up with them. The parents have been fantastic. Grace has been fantastic as a patient, and we started with expanding her top arch sideways, and we succeeded in doing that, and then we put a complete set of braces on her, both in the upper arch and in the lower arch, and we've continued from there. So we've made a lot of progress in terms of widening her arch. What we want to do for Grace now is to move the top arch forwards. It's actually sitting all the way backwards, which is very usual in cleft patients.
During a recent visit to a doctor friend at the Lagos University Teaching Hospital, Luth at Idiaraba, I was introduced to another cleft patient, Shedrack. At 36, Shedrack, a graduate of accounting from Delta State University, is yet to find a wife. He has suffered a lot of embarrassment, low self-esteem, and at some point felt like ending it all.
It's quite challenging. It all it is. People really for me or like kind of embarrassing. They laugh at me and they make me feel I'm less human. People really don't want to listen to me. After all, I know what I'm doing. Even if I have something meaningful to contribute, they don't, they don't look down around. They don't look down on them, I know it's not easy. I would like to do it. It's not really, really easy. I focus from a look at the team. I would like to do it. So I need to be kind to people like us. Because not yet, we are running the work, the mind and the hope that yes, there is good no more.
Cleft lips and palate is a congenital abnormality that occurs during the developmental stage of pregnancy. It presents with an opening in the upper lips and may extend into the nose or palate.
Cleft lip and cleft palate, they are birth defects that the baby is born with. The cleft lip affects the upper lip, while the cleft palate affects the roof of the mouth. The cleft lip presents as a gap on the upper lip. There is discontinuity in the lip. You can even describe it as a split, and that is why it is also described as hair lip. It is also called as hair lip because there is a defect in the upper lip, and in the palate there is a hole. Normally, there should be no communication between the nose and the mouth, but when there is a cleft of the palate, there is now a communication between the nose and the mouth. So when the child eats, instead of the food going straight into the esophagus, some of them will go into the esophagus, but a lot of them will now be going into the nose, into the upper airway. So the food will be coming out through the nose. There's a lot of social stigmatization because some people believe that these children, they are evil, or the mother had given birth to the child because of either her wayward ways or because of a curse on her or on her family. So they don't believe that it is something that is naturally occurring, that the baby is born with. So they tend to either hide the children, and some of them even kill the children.
Though the cause of this condition remains largely unknown, some experts in the medical field have identified lack of folic acid in pregnancy, diabetes mellitus, genetic factors, smoking during pregnancy, advanced age of parents, and certain medication as risk factors.
It's common worldwide. It ranges, the prevalence of this particular disorder, that is the frequency in the population, ranges from anything from 0.5 in 1,000 to what we have in Nigeria, which is 1 in 2,000. The use of epileptic drugs during pregnancy, exposure to radiation during pregnancy, excessive alcohol intake, and so on and so forth, or an excessive amount of cortisol, which is your stress hormone in the body. All these things have been linked to the occurrence of cleft lip and palate in babies. But the defect starts as early as 6 weeks in utero, where the processes fail to fuse. They fail to come together. The palatal processes or the lip processes fail to come together and fuse at that stage, and the patient continues to develop, but without that union having taken place. So you want to make sure that you take your vitamins during pregnancy. You try not to take toxic solutions. There are all kinds of agbos out there that people may take, and we don't know whether there's a direct connection yet between them and the occurrence of cleft lip and palate. You want to stay away from having x-rays or being exposed to x-ray radiation during pregnancy. You certainly want to make sure that you don't consume an excessive amount of alcohol during pregnancy. So all these factors that have been pinpointed as being possible causes are things you want to stay away from. And you want to reduce your stress level as well.
Speech defect, dental malformation, feeding problems, and frequent ear infections are common complications associated with persons living with cleft lips and palate. This explains the long list of specialists involved in the management and care of patients.
The mother has problems with feeding. The patient often is exposed to recurrent infections. The way the teeth develop and the ways the arches develop, that is the way the mouth itself develops, the upper arch of the mouth is affected by this particular anomaly.
The care of a child with cleft lip is holistic. It is multidisciplinary because they have a lot of challenges. A child who has a problem with the speech can be restored through therapy. Those who have deranged occlusion, that the teeth are not properly arranged as a result of this problem, they too they can have access to care. We provide what we call a multidisciplinary care that involves every problem that the cleft child may have. Because the problem a child who has a cleft lip and palate has is enormous. It goes beyond just closing the gap that you can see. As we said earlier on, the child will not be able to eat well because the child cannot suck, because the child cannot feed. He cannot suck, but he cannot suck bottle. The food is going out through the nose. So that one also needs care. We need to beef up the nutrition, because if the nutrition is not improved, because the child cannot take in adequate food, the child will not thrive. The child will not be well. The child cannot be able to have surgical treatment. The child also cannot speak well. So you need somebody, a speech therapist that will take care of that. You need the surgeon that will correct the gap, that will surgically correct the gap. You need an orthodontist that will correct the deranged occlusion. You need a nutritionist that will help with the feeding. You need a pediatrician, children's doctor, that will make sure the child is fit and well to be able to withstand surgery, and then to check if the child has other problems, other congenital problems. You need a pediodontist who is a children dentist that will also help with these children when the teeth are coming out. So the treatment is multidisciplinary. You need a nurse that is going to take care of the patient before the surgery, after the surgery. You need a clinical psychologist that can counsel the person, that can improve on their psychosocial well-being. So it's multidisciplinary. You cannot leave one out. Everybody is important. Every treatment is done at a stage. Everything is not done once. You start at 3 months, you do one at 3 months, you do one at 6 months, you do one at about 8 years, you do one when the child is about 18 years. So I would say to complete the treatment can take between 18 to 20 years.
They face a lot of challenges with their speech, and that occurs because of because of the nature of the defect. It affects the palate, and the palate is an important portion required for speech, developopharyngeal function. But to put it very simply, it affects their palate, and when palate function is affected at birth, speech is also affected. And so there are a lot of things that are done from when the patient is born to when the patient becomes an adult to address speech in particular, in addition to all the other defects or the other challenges that these patients have. At every stage of point in care, every milestone, early adult dentition when we have to arrange their teeth, and even also early primary dentition when we have to help them with their speech, there is care that can be provided to correct whatever anomalies or challenges the child will present with. And so there's hope. We have many of our patients who we've been treating from when they were children. They become successful adults, integrated in society, doing and achieving great things. So it's something they shouldn't worry at all about.
There are some that don't have the speech problem, like some of them that don't have opening at the roof of their mouth, which is the palate. Some of them don't have that speech problem. They speak well. But some that have that, the lip and the palate together, they usually have speech problem. Even some with the lip also, but not all.
From research, 1 in every 940 children in Nigeria are born. In other countries, 1 in 700, 1 in 1,000 children are born, depending on if you're an Asian, if you're Black, African, and it varies. But it is a deformity that you don't acquire as you grow, but you are born with it. If people are aware that this deformity is just like any other deformity, people should not be stigmatized. They should not go through trauma because of it. And bearing in mind again that the solution is right here in our doorstep. It's not that they have to fly abroad to get treated. No child continues to suffer. No person, not even just child, no person, child, adult, male, female, irrespective of your race or religion, continues to suffer because of cleft.
Because of the stigma, especially that is attached, it's not something we can afford to just gloss over. So we encourage the media to keep on being the voice of this particular group of persons.
Don't look at your baby that has a cleft lip and palate and feel my life is finished. Or this child's life is finished. No, it is not. There are many patients out there that are doing well, thriving well. It doesn't affect their brain function. It doesn't affect their ability to move, their ability to think. Find a center, register your child, and get the help that you need.
Drawing from experts' opinion so far, people with cleft lips and palate are indeed normal human beings. They can have a normal life with relevant support and a society devoid of stigmatization. On our nutrition segment, we preach the message of eating right to stay healthy.
Scent leaf, commonly known as clove basil in English and efirin in Yoruba, is a strong aromatic herb native to Nigeria, Ghana, and some parts of Africa and Asia. It is found in farms, gardens, and mainly used as a spice for cooking delicacies due to its aromatic taste. Scent leaf has antibacterial activities against Staphylococcus aureus, Salmonella, and Candida albicans. It is also a repellent against houseflies, mosquitoes, and other insects. As a vegetable seasoning, it gives every meal a delightful, unique, and sweet taste. From research findings, there are numerous health benefits from scent leaf. Scent leaf aids digestion. It helps bowel evacuation and weight management. It can be used to treat oral infections as it kills all bacteria in the mouth which cause tooth decay and bad breath. Scent leaf is used in the treatment of fever, cold, catarrh, as well as skin infections like ringworm. Scent leaf has antibacterial activities against Staphylococcus aureus, Salmonella enteritis. Extracts from scent leaf has also been reported to lower blood pressure, blood sugar, and potent for the treatment of gastroenteritis and lots more. Scent leaf can be taken as a tonic. It can be taken like salad or added to dishes during cooking.
Come with me to our clinic for tips on healthy living.
The Omicron COVID variant is a new one, which is coming from South Africa. Actually, it was first reported in Botswana, but it was discovered by the South African scientists. It is one that has over 50 mutations, 30 of them in which are in the spike. You know, the spike is the one that the virus uses to attach to the body, to the cells. But also the teeny one of these 30, 10 are new in what you call that special part of the spike that uses to bind onto the cells. And it's for this reason that WHO has looked at it, and there's a fear that it may be a different virus, which may be worse than the Delta strain or the Delta variant. It has been reported in a few other countries, as far as Hong Kong, Israel, Botswana itself, and South Africa. And they're having quite a lot of number of cases from South Africa. So, on the issue of some cases being recorded amongst people who have been vaccinated, yes, that's expected. I mean, if it's a new strain, it will not be, the immunity will not be as specific as with against the virus for which it was, which the vaccine was produced. So it is expected. But the good thing is that vaccination is always good, because you're not going to find these people getting severe disease or dying from it.
In our perception segment, we give a voice to your opinion on the way forward for the nation's health sector.
We have the best doctors in the world. What do you need to build a hospital? You have land, we have land. You have a building, the building materials are in this country. And then you buy some equipment, which we can get, and you can do a deal and replace them every 5 years as new technology changes. And you have the population, and you have insurance to pay for it. So really, if we don't have a great health sector in this country, that must be the most incompetent part of anybody in office.
This is where we wrap up the show today. Please join us same time next week for another exciting edition of the program. I remain your host, Oshuomowa Daniels. Remember that your health is the greatest asset you require to achieve all other things. Please pay attention to it.